Hello, everyone, and thank you for joining. I hope everyone is doing well today. We are going to get started. Just a few, just a few rules before we go. Well, not rules, but helpful hints. If you come on, please self-mute. If you would like to ask any questions to the presenter, questions will be asked towards the end. If you have any questions towards the presenter, please access your chat box to the right. You could write the question in. You could question the presenter privately or send it to the entire group chat or send it to me, which is under Sickle Cell Consortium. Before we begin, the patients, caregivers, and community-based organizations of the Sickle Cell Consortium are delighted to provide Warrior University as an online curriculum-based education module. However, please note, this is a general discussion and is not meant to replace the advice or instructions of your doctor or other healthcare professional. Statements made are not meant to reflect the policies, thoughts, or opinions of the consortium and do not imply endorsement or recruitment for any product, service, or clinical trial. As a reminder, this class is recorded and will be made publicly available online. Private questions should be addressed to me, listed as me, Dominique Goodson, listed as the Sickle Cell Consortium, or directly to the presenter. Thank you guys for joining. And we will begin. Hello, everyone. My name is Dominique Goodson. I am Dean of Warrior University. And today we have with us Dr. Jakarla Jordan. Dr. Jakarla Jordan is a licensed professional counselor. She has nearly 10 years of experience in the profession. She serves children, adolescents, and adults in either individual and or group settings. Therapeutic services targets those who struggle with issues such as depression, anxiety, suicidal thoughts, family issues, stress management, bullying, relationship problems, anger issues, grief and loss, etc. And assisting clients with addressing problematic areas in life, she practices a therapeutic integrative-based approach. So without further ado, I would like to introduce everyone to Dr. Jakarla Jordan. Thank you, Dr. Jakarla, for being here. How are you?
You're welcome. I'm fine. Such an honor and a privilege to actually speak today on mental health, depression, and how it affects sickle cell patients.
Well, thank you for being here, and you can continue. You can start your presentation. Thank you so much for being here.
You're welcome. So again, the title of my presentation is Depression and the Sickle Cell Warrior, presented by myself, Dr. Jakarla Jordan. And before we go farther, I just wanted to say that I am a native of Mississippi, Goodman, Mississippi, born and raised. That's where I have my private practice. But again, I'm so honored to be asked to speak with you guys, and I'm looking forward to it, and I hope you guys enjoy the presentation. Feel free, again, to ask any questions that you may have near the end. So, to start off, just basically, what is depression? For those of you who may not be aware of depression or what depression is, simply it's a very serious mental illness that affects the way we think, affects the way we feel, and the way we behave. Depression can also cause severe emotional issues. Depression not only affects you emotionally, but it can also cause physical problems such as stomach ache, headache, different kinds of bodily aches and pain can also be related to depression. Depression impacts your home life, your work life, social life. Some individuals with depression may not be able to function on a daily basis if they have symptoms of depression. And let me just add this most important thing about depression. Depression has to be diagnosed with certain symptoms, and which will bring us to our next slide. It will give a list of symptoms in order to have a diagnosis of depression. Here are some of the symptoms. If you see the first one, it says feeling sad. So, like, for an example, you may have heard someone say, "Oh, I feel so sad." Then within the next day or so, they may say, "Well, I'm not sad," or "I don't feel depressed anymore." The difference between sadness and depression: sadness is an emotion that does not linger. It doesn't linger. You know, a person wouldn't say, "I feel sad for 3 weeks or a month or 2 months." It's the time frame that sets them apart. Sadness could last maybe a couple of hours, maybe a day. But when you get into, "I feel sad," and it's 3, 4, 5 weeks later, you're moving more so on the lines of clinical depression or major depressive disorder, which definitely requires some attention. So be aware of the signs. Don't ignore any signs or symptoms of depression. And usually for a person to have a clinical diagnosis of depression, they will have to experience at least 3 to 5 or more of these symptoms. And it's hard to have one without having 2 or 3 more other symptoms. For example, quite naturally, if a person say they feel tired, naturally they're either going to have problems sleeping too much or sleeping too little. It's going to affect their eating. They may not eat enough, or it may eat very little. They may lose interest in pleasure. If you know a person who actually loves playing basketball, and if they go 3, 4, 5 weeks without doing something that you know they enjoy, then that is a sign that that person may be suffering from depression. So pay attention to these symptoms. You can Google symptoms of depression. If you forget symptoms, you can always Google. You can ask your primary care doctor, what are some signs of depression? I think I may be experiencing depression. Ask questions. That's the only way you're going to know. If you don't ask, you don't know. And so there you go without getting the help that you need. So again, I'm just going to go through all of these symptoms. Feeling sad, loss of interest or pleasure in activities once enjoyed, changes in your appetite or weight gain, sleeping too much or too little, loss of energy or increased fatigue, feeling worthless, hopeless or helpless, difficulty concentrating, thinking, or making choices, thoughts of death or suicide. And let me just add something to the last one, thoughts of death or suicide. Sometimes people who are severely depressed may say, they may just come straight out and say, "I want to kill myself," or "I don't want to live anymore." And it's also something called a wish for death. Wish for death, they may not verbally say, "I just want to kill myself," or "I want to die." They may say things like, "Well, I wish God would just take me. I wish I didn't wake up in the morning." So that's the difference between people actually making suicidal thoughts or verbalizing suicidal thoughts and having wish for death. Wish for death is simply saying, "I wish I was dead," or "I wish God would just take my life," versus thoughts, "I want to kill myself. I'm going to get a knife and I'm going to stab myself," or "I have a gun and I'm going to shoot myself in the head." When it gets to that point as a therapist, of course, therapists will tell you at the beginning of the session about confidentiality and under what circumstances where confidentiality will have to be breached, and this is one of them. If you tell a therapist that you want to kill yourself, our next thing is to assess, to see if you have a plan. If you have a definite plan, then of course confidentiality will be breached at that moment. So again, these are some of the symptoms and signs of depression. If you are experiencing any of these signs, symptoms, please don't let these symptoms continue to linger. Get help. Our next slide is forms of depression. If you look at the first one, it's major depressive disorder. You will hear people either say major depressive disorder, or they may say you may have clinical depression, which they're both are the same. And what major depressive disorder is, going back to the previous slide that listed all the symptoms again, if you have at least 3 to 5 or more of those symptoms that's happening for at least a 2-week time frame or longer, you are at risk for getting a diagnosis of major depressive disorder or clinical depression. If we go on to the second one, persistent disorder, depressive disorder, also known as dysthymia. This is a point where a person may experience short periods of not feeling depressed. So you may go 2 weeks, 3 weeks, and not have any symptoms of depression at all. But the thing with this type of disorder is you will only have relief of these symptoms for about 2 months. After that 2-month time frame, quite naturally or normally a person would start to experience those symptoms of depression again. Persistent depressive disorder is not as severe as clinical depression. Seasonal affective disorder, and it's pretty much self-explanatory, the seasonal part. This is where a person may experience symptoms of depression based on a particular season. So you may have more symptoms of depression in the summer than you would in the winter, or vice versa. You may have more symptoms of depression present in the winter than you would in the summer. And usually this type of depression is related, something usually happens. So like, for example, a person may experience more depressive symptoms in the winter because maybe they lost a loved one. And when that loved one expired, they were there, they were at the hospital, they remember vividly everything, if it was raining, if it was sunny. So when that next year come around, the closer it gets to that event, then a person would start to experience symptoms of depression. Sometimes it happens like days before, weeks before, because you know that particular time is coming around again. So those signs of depression start to resurface. When we talk about bipolar disorder, there are 2 types, bipolar 1 and bipolar 2. Bipolar 1 is much more serious it's much more extreme than bipolar 2. Bipolar 1 is when bipolar 1 is more so when a person experiences extreme or abnormal, their mood is elevated abnormally, which is called mania. A person with bipolar can live an effective, healthy life if they comply with medications, therapy, the different types of treatments that offered to them. They can live a pretty productive life. When we talk about bipolar 2, the mood swings are not as extreme, which is called hypomania. So bipolar 1 and bipolar 2, those are the differences between those two. And I'm sure everyone has heard of postpartum depression. That's pretty much when you have a baby right after a woman gives birth to a baby, especially if it's your first child. It's very common with women and their first kid. And I can pretty much personally attest to that because I think I experienced some postpartum depression. after having my first son. But did I get therapy? I didn't, but I have a lot of therapy friends, so, I kind of talked through some of my friends with it. But have I ever seen a therapist? Yes, I have. Our next slide, which brings us to risk factors for depression. If you look at the first one, it says biochemistry, which means that sometimes we have certain chemicals in our brain that contribute to depression. Genetics, we all know what that means. If you ever seen a therapist before, if you've ever seen a psychiatrist before, that's generally one of the questions that they ask. Does depression run in your family? Does anxiety, does schizophrenia, does any type of mental health disorders run in your family that you are aware of? Personality, when it speaks on personality, pretty much means if you have a person that has low self-esteem, they are highly liked or highly linked to experiencing symptoms of depression. If you have low self-esteem, you already feel pretty bad about yourself, then likely you're going to put yourself at high risk for depression. Environmental factors, people who live in poverty, people who struggle with financial problems, people who have relationship issues, anything environmental that you can think of can definitely contribute to symptoms of depression. And of course, we all know health issues contribute to depression. For example, our topic that we're talking about today, sickle cell, stroke, heart attack, any type of health issues can definitely lead to symptoms of depression. Sickle cell. What is sickle cell? So I'm just going to read this verbatim. Sickle cell is an inherited red blood cell disorder. In someone who has sickle cell disease, the red blood cells become, I can't see. I'm trying to see if I can move us up. I can't see that part. Sticky and look like a C-shaped form tube called a sickle. The sickle cells die early, which causes a constant shortage of red blood cells. Also, when they travel through small blood vessels, they get stuck and they clog in the blood and clog the blood flow, which is the ultimate reason or the cause of why sickle cell patients have to endure so much pain. So this is my first time presenting on depression and how it relates to sickle cell. So that's why I wanted to get something. And this came from the CDC website. That's why I wanted to get something and actually read to you guys. So next slide. Okay, psychological impact of sickle cell. I read, while doing my research, I read a couple of articles on people who suffer from sickle cell and how it impacted them as far as like psychologically, emotionally. And these were some of the impacts that were noted pretty regularly. Feelings of isolation, and with this one, I read that some sickle cell patients have very little to no support, or if they have a strong support system, they typically experience family members like not being able to relate to them or not understand the severity of their pain. They don't understand that, 1 hour or 2 hours before I consented to going to the mall with you, within that short period, within that short time frame, I'm having a crisis. So that's where I think that part, that feelings of isolation is more so of sometimes you all may have a support system, but the support system not really understanding the aftermath of having a crisis and how it impacts the body, and not only the body, but how it impacts you emotionally. And of course, that goes along with sadness. So if you feel isolated, if you feel nobody understands me, nobody understands my pain, what I'm going through, of course that's going to create a sense or a feeling of sadness. A lot of them, some of the patients reported low self-esteem, even physical appearance. Some of them felt like they didn't look as pretty or wasn't as handsome because they are always sick. When you're sick, you feel bad, so you look bad. And with the hopelessness piece, I read that a lot of sickle cell patients, they had frequent occurrences to the ER. They had, to go to the ER, be admitted into the hospital, stay a couple of days, and they just felt hopeless, felt like, things wasn't going to get any better. Some of them even reported feeling a sense of helplessness, not knowing what they can do to help themselves because they felt like the crisis was pretty much just taking over their lives, which also ties into negative thoughts. All of that leads into negative thoughts, which is why sickle cell patients who suffer from, chronic illness, chronic pain, and they have feelings of isolation, that's why they need to see a therapist or create a solid support system whom they can go and talk to without no judgment. So treatment for depression. The first one is psychoeducation. Working as a private practice therapist, I use psychoeducation all the time. And with sickle cell, with any health condition, with any health problem, you need to be educated on your actual illness, and you need to be educated on mental health illnesses, such as depression, because if you have an illness, sickle cell, or whatever the illness may be, if you're not educated on what treatment that's available to help you emotionally, then you can just be suffering, and it can be help available and you not know. So again, psychoeducation. We're going over this presentation today, and I've given you signs and symptoms of depression. I hope you all be aware of those signs and symptoms. Again, you can always Google. You can ask your primary care doctor to find out if you are experiencing any signs or symptoms of depression. Educate yourself on the signs and symptoms and also available treatments. Another type of therapy that I love, that I use a lot with all of my patients, even children, is cognitive behavior therapy. Pretty much what cognitive behavior therapy focuses on the mind. It focuses on taking these distorted thoughts or these negative thoughts and changing them into more healthy, more productive ones. That does not happen overnight. Changing thoughts or changing the way a person thinks can be very, very challenging. But if an individual is coming to therapy, that within itself says, I need help, I want help, I don't know how to help myself, so I'm willing to come and learn different ways to help myself. The behavioral part is pretty much using techniques to help an individual. Like, for example, I like to give my patients homework. That will be the behavior part. And if I say, we're working on depression, for next session, I would like for you to make me a list. Write me a list of all of the things that you feel triggers your depression, and bring that back to me for the next homework assignment. And so I like when they bring it back, because it really shows me that they are really trying to do what they can on their end to help themselves. Mindfulness meditation is also a form of CBT, cognitive behavior therapy. I know with sickle cell patients, they have a lot of pain, chronic pain. And mindfulness, I've never personally worked with a patient who had sickle cell, but I have worked with patients who have had other chronic illnesses that cause a lot of pain. So with some of them, I've done like mindfulness stuff. I read, and I have them to close their eyes, and I would turn the lights down, try to get them in a peaceful place, a place of calmness and relaxation, to pretty much to try and take your mind off of the pain and to be present in the moment. And I know definitely with excruciating pain, that can be very, very difficult to do. The next one is electroconvulsive therapy. I haven't had any patients personally who have undergone this type of therapy, but this type of therapy is used for patients who have severe clinical depression, and some treatments don't work, so they have to do the electroconvulsive therapy, and it involves using brief electrical stimulation of the brain. And of course, the patient is asleep, so there are like a team of people, like a psychiatrist. There is you have the nurses, and of course you have the anesthesiologist, and they'll put you to sleep. I'm not really sure of all the details, but that's just pretty much an overview. And medication is another form of treatment of depression. Now, I've had patients who have been reluctant to come to counseling because of medication, and they automatically think, well, if I come to therapy, I'm going to have to take medication, and I don't want to take medication. I don't want to take, okay, that is fine. That's fine. This is what we'll do. We'll try psychotherapy first. We'll try the therapy for a couple of weeks, couple of sessions, and see if therapy alone boosts your mood. If it doesn't, then let's talk about a combination of the both. But again, I always tell them it's your choice. You can decline medication if you would like. But again, if you've been coming to therapy for 4 months, 5 months, 6 months, and your mood has not improved a bit, then you may want to consider other alternatives. And usually with medicine, talk more with your psychiatrist about it. I encourage them to ask any questions, ask about the side effects, ask any questions that you don't know. Don't be afraid to ask. Self-help strategies, I love this one. Self-help with my clients, even the ones who come for chronic pain. What can you do to help yourself? Some things are beyond our control, such as being diagnosed with sickle cell or being diagnosed with an illness, from birth. We can't help that. We can't control that. But again, what can you do on your end to help yourself, whether that's coming up with an exercise regimen, and be careful with that. Consult with your doctor. You know the level of your pain. Some people with chronic illnesses may not be able to do any type of physical exercise. You may benefit from doing mindfulness, deep breathing. That may be more of a choice for you than actually exercising and jogging and doing more of the physical stuff. Another one, self-help strategies. be mindful of what you eat. Be mindful of your diet. That's always, even if you don't have a health issue, that's still something that's very important for us to be mindful of, what we put in our bodies. Avoid alcohol. I know, and I've actually had some clients who suffered from chronic pain to actually say, I drink, it helps, kill the pain. It helps take my mind off thinking about my illness. It helps take my mind off thinking about being sick. But the thing about that is, when you stop drinking and when you sober up, that health issues, whatever problems that you are trying to escape will still be there, and you still will have to find a more productive way to deal with those problems. And I know, and I've had some clients actually tell me that's how they got addicted to alcohol, because they liked the way it made them feel. It took away worries, it took away pain, and it just made them feel so much better. But again, it's not long term. It can be long term, but you will also have to risk becoming addicted to alcohol, and you don't want that. You already have an illness, and then you have an illness on top of an illness, alcoholism, which is not good. But I know with chronic pain, I know a lot of people have to take opioids, which is, understandable, to help kill some of the pain or decrease some of the pain. But, you don't want to use self-inflicted measures to decrease the pain, because in the end, it's only going to make things worse for you. These are some, before ending, I cannot see. I wanted to read my quotes, whatever. I'll just start with the second one. These are some, and let me just say this personally. My son's paternal grandmother, she had sickle cell, and she passed away probably it was 3 years ago. She passed away 3 years ago. It wasn't from the actual disease of sickle cell. She was in a car accident, but because the car accident was so intense, it was really bad. I'm sure her sickle cell, her crisis kind of played into that. But she was, y'all, when I tell y'all she was so resilient, that lady, she did not miss a beat. You could never, ever tell when she was in pain, when she had a crisis. You didn't know. Whenever you said, let's go, she was ready. I've never seen her act, why me? I never heard her say, it's not fair. I never heard her even say anything negative about her illness, about sickle cell. She never talked about it. The only way you knew she was in pain was at the last minute, to where we had to take her to the hospital. That was the only, and I guess the pain had just gotten unbearable then, and she had to, go into the hospital, and they would give her meds through her IV to help decrease some of the pain. But y'all, she was so resilient. But these are some of the quotes that I wanted to share. Some of you all, and I just pulled it right off the website. Some of you all may have read these quotes, but I thought they were really good. So I just wanted to end by sharing something positive. If you are faced with the mountain, you have several options. You can climb it and cross to the other side. You can go around it. You can dig under it. You can fly over it. You can blow it up. You can ignore it and pretend it's not there. You can turn around and go back the way you came, or you can stay on the mountain and make it your home. In every situation, regardless of what it is, we have a choice. We have a choice. The next one says, the greater the obstacle, the more glory in overcoming it. Very powerful. I am more than my scars. Let me just read that one again. I am more, I want to say much, I am much more than my scars. What makes people resilient is the ability to find humor in situations that will otherwise overpower you. Laugh. Don't be so serious all the time. Laugh. It makes you feel better. Most people live in fear of some terrible edict change. Most people live in fear of some terrible event changing their lives, the death of a loved one, or a serious illness. For the chronically ill, this terrible event has already happened, and we have been let in on an amazing secret. You survive, you adapt, and your life changes. But in the end, you go on with whatever compromises you have been forced to make, whatever losses you have been forced to endure. You learn to balance your fears with the simple truth that you must go on living. So again, I just want to end by saying thank you all for allowing me this opportunity to speak with you on the psychological aspect of sickle cell, and for those of you who are chimed in and who have the actual illness of sickle cell. If you're suffering from depression, if you didn't know what depression was, if you didn't know the symptoms of depression, now that you know, and if you feel like you need help, ask for help. Ask for help, please. So again, thank you. And at this time, we are taking questions.
Thank you so much, Dr. Jordan. That was very amazing. It's very good. So we do have a few questions. Our first question is, can someone else recognize these signs of depression and recommend these treatment options, but who forces or suggests that these treatments be taken? Most people usually don't want to admit their mental health.
I agree. I agree to that wholeheartedly. It is up to the individual. Another person can recognize that this person may be, I see depressive symptoms in this person, and I'm going to go to them and tell them, look, I went to a presentation on depression, and I really think you have the signs, and I really think you should get some help. That's very valuable, and that takes a lot of courage to be able to do, but you can only do what you can do, is present the information to the person and just hope that they'll receive it wholeheartedly and get the help that they need. That's on them whether or not they, chooses to go or not. So, yeah, and that's another thing, going back to psychoeducation. If that person is not aware and they have someone who is aware and who is knowledgeable about depression and the signs and symptoms of depression, then yeah, but it's up to that person to actually be receptive to the help.
Thank you. That was very helpful. Another question. Is marijuana use a reasonable treatment option? I know you were saying in your presentation that sometimes with depression, if it's bad enough, you have to be on medication. And I know this personally because I see a therapist. And at one point, from the trauma and everything of crisis attacks, it was so bad that even though I was going to my therapist appointment, I wasn't actually doing the work. And 6 months in, nothing had changed. And family and friends was like severely worried. And then my therapist was like, we might need to try medication. So is marijuana used for a reason, is a reasonable treatment option?
I'm not going to say yes, and I'm not going to say no. That would be more of a question maybe for a psychiatrist to answer, since they deal with the medicine. Me being a therapist, I don't I don't prescribe any type of medication. So I would say if you're seeing a psychiatrist or if that's something that you really want to know, you may want to consult with a psychiatrist and get their take on, that. And just to go back to what you were saying about you going to therapy, but you wasn't actually putting in the work, that's another thing. I tell my clients all the time, you can't just come to therapy and say, I want help, but you're not willing to do the work. I tell them, I don't have a magic wand that I can just wave around and say, hey, let all of her problems that she has disappear overnight. And when she wakes up in the morning, all of her problems will be completely gone. With therapy, it doesn't work so fast. I wish it did, but it doesn't. You have to be vested. You have to put in the work. You have to put in the time. Just like everything else, you have to work for your mental health. Yeah, we're just there to guide you along the process, but the clients have actually got to put in the work. And I tell my clients now, if I feel like I'm working harder than you to help you, that's a problem. I shouldn't feel like I'm working harder than you to help you. I want us to be balanced. I want you to feel like you're working hard to help yourself, and you have me working hard to help you. It needs to be balanced, not lopsided.
Thank you. One of the major things, and most of the community is that, and pretty much everyone's community is that mental health is a stigma. And it's the same for the sickle cell community as well. What do you say to a person that knows they need to seek help and should seek help, but is a little apprehensive because of the stigma of mental health?
This is what I would say because of the stigma, and it's easy to say, well, you shouldn't care about what other people think, but that's not true. People do care about what other people think of them. I would tell them, if you are apprehensive, if you don't want to go, read about it, educate yourself on it. Talk with someone who you think who's seen a therapist already. Get their experience on it. Because at the end of the day, people are going to talk regardless. You have got to do what's best for you. And if they were talking to a friend about not wanting to or being scared, what are your fears? What are you afraid of? I mean, what do you need? What do you need to help you to get the help that you need? So I would really try to see or find out what exactly the fear centers around. Is it because you're afraid that people are going to talk about you? Is it afraid because people are going to think you're crazy? What exactly is it? So let's talk about that. So, yeah, just pretty much finding out what is the root of the fear.
Thank you. Can hypnosis be a reasonable treatment for depression?
Now, I'm not going to say yes and I'm not going to say no, but personally, I haven't. I've never used that. I've never used hypnosis. And if I'm not mistaken, I think people that do that, they have to be certified or they have to be trained because you really have to know what you're doing when you're doing that. So that's kind of out of my scope. I've never used hypnosis. But I think you can Google therapists or, to see who uses that as a treatment for depression, but again, I've never used hypnosis.
Thank you. The sickle cell community lives in a constant state of grief. What therapy options are available to combat depression in the midst of constant grief?
It would still be cognitive behavioral therapy. With grief, people go through, there are 5 stages of grief. Not everyone grieves the same at the same time. People grieve at different levels, at different rates. So I would definitely say there are therapies available to help people with grief. Again, CBT is one of my go-tos. I use positive psychology. I use solution-focused grief therapy, and it depends on again the degree of the grief. You know, how severely a person is grieving. So yeah, there are therapies available for people who experience grief related to the chronic pain in the sickle cell.
Thank you. If someone wanted to seek out help, if they knew that they needed help and they wanted to seek out help, but they didn't want to involve anyone else, how would they start that process, and where would they go to start looking for help for a therapist?
There's a website that's called Psychology Today. And if you go on Psychology Today, they have like a list of therapists listed. And under each therapy, it has like a write-up of what the therapist specializes in. So I would say start there, go on a site like Psychology Today, and it's almost like you have to just read their profile and see if that fits your need. Because, you know, sometimes when you see people and you read their profile, yeah, I don't think you may say, well, you know, they offer some good stuff, but I'm going to keep looking around. I'm going to keep, you know, looking for someone who I think I may feel comfortable with. And you can like give them a call. You can send them an email. So yeah, you can. There are sites available where you can, if you don't want anybody to know, and they also therapy where, you know, you can do the therapy online like we're doing. We can do face to face instead of actually going into an office. We can do it online. So yes, it's help available if you don't want people to know that you're getting counseling. It's sites available where you can find a therapist. And Psychology Today is one of the big ones.
Well, thank you. That was very helpful. I want to also let our viewers know that Be the Match is also, because May is Mental Health Awareness Month, Be the Match is also providing sickle cell patients with counseling because of this COVID-19. And so if you guys are interested and want to do it, you could sign up at bethematch.org/SCD counseling. You can sign up there, or you could go to our website, sicklecellconsortium.org/COVID-19, and it's up on our website as well. I want to thank you, Dr. Jakarla Jordan, for joining us. Thank you all for participating and asking these wonderful questions. But please remember, tomorrow we have Dr. Jakarla Jordan joining us again, and we have a panel with Shamanica Wiggins, me, Dominique Goodson, and Janine Green, and this one will not be Facebook Live, so please join us. It's more of an intimate experience where you guys can ask all the questions you want to not just our presenter, but also to the panelists as well. Thank you guys for joining, and Dr. Jakarla, is there anything else you would like to add?
I don't think so, but thank you guys for your time. Thank you for chiming in and listening to my presentation. I hope you all took something that was very meaningful and helpful as well. Thank you again.
Thank you. Thank you all, and we will see you all tomorrow. Thank you very much.
Thank you.
Bye, everyone. See you tomorrow.